From the Toronto Star, I'm Saba Eitizaz, and this matters. We're in lockdown, forced to be at home, unable to travel, and it's been tough. But now imagine the opposite. Being forced out of home, forced to travel, forced back to the place you once escaped, in the middle of a deadly pandemic that has closed down the world. A Reuters report has revealed disturbing data about mass deportations in Canada. In the middle of a global health emergency when no one is supposed to be traveling, Canada deported more than 12,000 people, its highest number since 2015. Even as US President Joe Biden worked to pause deportations, Canada has been carrying on with its own version since August. The government says this was necessary and done safely. But many are questioning why this is happening now, and whether Canada might also be deporting a health crisis along with the thousands deported. Joining me today is Maureen Silcoff, president of the Canadian Association of Refugee Lawyers, and she's going to talk about how mass deportations during a devastating pandemic could be a serious health and humanitarian concern. Thank you for joining me, Maureen.
Thank you, Saba.
So Canada has counted more than 12,000 people as removed in 2020, which is about 875 more than the previous year, and the highest number since at least 2015, according to the Canada Border Services Agency. And even those, it claims, are people who left on their own, jumped from more than 1,000 to more than 8,000 last year. What's your understanding of why these numbers have spiked?
It's interesting to see the difference in the numbers because, of course, we're in a pandemic and Canada Border Services Agency, CBSA, had decided to suspend removals in March. So when the pandemic hit and lots of changes were made, we saw that entry into Canada had been greatly restricted. And similarly, at the same time, CBSA decided to suspend removals initially for a 30-day period, but they carried that on until November 30th. Of 2020. And during that time, there were just a few exceptions. So if somebody was subject to serious inadmissibilities, which means serious criminal offenses, crimes against humanity, perhaps they posed a security risk, they would be removed nonetheless, despite the suspension. And of course, if people wanted to leave voluntarily, they were able to do that. What we've seen is an overall suspension for many, many months. I think that policy struck a really good balance between protecting Canadians and also the risks of forcing people to uproot themselves and travel internationally during a pandemic. So what's happened, though, as of November 30th, CBSA decided to change its policy. It abruptly, without any warning, decided to resume removals at the very height of the pandemic. And I find that nothing short of alarming. It's completely out of step with all the measures that the Canadian government has been taking to protect public health. We know, in fact, that the numbers of COVID cases have surged in recent months and people have reacted. So those who can work at home and those who can't are, of course, taking risks when they go out to work. They have no choice. We see, kids who are doing online school right now in a number of places. And still, of course, outbreaks continue in large workplaces, in long-term care homes. So, just as all levels of Canadian government, and of course all of us, are taking measures to contain the virus, CBSA decided that it's a good time to really return to business as usual and has ramped up removals. So, in fact, it's quite shocking. Their November 30th announcement came on the very same day that an all-time high of COVID cases were recorded in Canada. I think we hit over 7,000 cases that day. That was the highest to date. Yet at the same time, CBSA was saying, well, we're going to resume removals as though there's really no issue here. So we know now that the virus is airborne. We knew that on November 30th. As time goes by, we've seen the new variant come in various forms that's even more transmissible than what we thought the coronavirus had been several months ago. So all public health experts are warning against international travel. And because of that, it's really mind-boggling. I think the removals policy is a public health risk and needs to be reversed immediately.
So, on the one hand, the government has been warning against any kind of travel. And on the other, they're deporting thousands of potentially vulnerable people in the middle of a global pandemic, like you said, acting like it's business as usual. So that would be an accurate assessment, right?
Exactly. And even recently, the Prime Minister has urged us all to avoid non-essential travel, especially internationally, due to the risk of spreading coronavirus, in particular because of the variants. And he announced additional measures to curb the spread of COVID-19 in conjunction with the airlines. And there was an agreement to suspend all flights to and from Mexico and the Caribbean till the end of April. We see that the Prime Minister has taken even further measures. And despite that, we still see no change in the policy of the CBSA. In fact, when the policy was first announced, several organizations who work with people who are subject to removal wrote letters of concern to CBSA. So the Canadian Association of Refugee Lawyers, of which I'm the president, the Canadian Council for Refugees, the Canadian Bar Association, Legal Aid Ontario, all wrote detailed letters to CBSA asking for their response. And to date, they haven't been able to explain why they've ramped up removals and they're so out of step with the rest of the government. In fact, we know that they haven't explained the reason. And you know what I'd like to ask is, where are the reports from the epidemiologists? Did CBSA consult with them? Why haven't they released information that they used to base this decision if they can back up their actions with science and offer expert opinions, from the same medical specialists who are guiding the government on public health measures? Then I'd like to see it. And I think it's quite concerning that we haven't seen that at all. In fact, when the CBSA decided to resume removals, it gave a few reasons by way of explanation, none of which I think really makes sense. So one thing they said in their announcement is a vaccine is emerging. Yes, it's great. It's emerging. We're all seeing that light at the end of the tunnel, but we know that it's going to be a while till everybody is vaccinated, and they have no policy to vaccinate those people who are up for removal. So I don't think that really is an answer. They've indicated they'll give people under removal hand sanitizers and masks, but of course, those are very imperfect. They also indicated that the suspension of removals was an exceptional measure, not really shared by the international community. But in fact, the United Nations Network on Migration issued a caution during the pandemic, calling for a suspension on forced returns during the pandemic in situations where health, safety, and human rights of migrants and communities can't be adequately safeguarded. So we know we have that international warning. So it's really, really very concerning at this point that CBSA has kept up with this removals process.
I will come more on to the risk factors in detail with you as well. So the CBSA statement said that the removal process includes many checks and balances to ensure that it's conducted in a fair and safe manner. And they're also basically saying that these were essential deportations. And the high numbers also include people who left on their own. What's your take on that? Were these essential removals at this point?
The CBSA from the outset of the pandemic in March 2020 said that there would be exceptions to the suspension for people who had been engaged in serious forms of criminality or post-security risks. So those were never paused. And so the rest of the people aren't really high priority. We know that everything has changed during the pandemic. The work situation, the school situation, restaurants are closed, everything has changed dramatically. So it doesn't make sense that CBSA keeps up as normal with removals. In fact, there was a case brought before the federal court judge in the summer dealing with somebody who was up for removal to the UK, and the court stopped the deportation, finding that the person would be subject to irreparable harm. And I'd like to point out that the court said three important things that I really hope that CBSA will think about and keep in mind. So they said, first of all, that CBSA has to consider the aggravated context of the global pandemic when deciding to remove people. So we're in a pandemic, you can't ignore that fact. The court also said, well, look at the effects of the pandemic. So of course, all deportations involve a certain level of upheaval and stress. But the court said, and I'm quoting, it's one thing to establish oneself in a country the applicant does not know. It's another to do so when the world has been turned upside down by COVID-19. This context would most certainly lead to grave peril. So the court recognized we're in an upside down world world. You can't just go ahead business as usual. And the third thing I wanted to point out from the court is that the conclusion was that person should only be deported when epidemiologists deem it safe for that person and the people around them at every juncture of the deportation process that would deem it safe. So I think it's important. And maybe I could just kind of take you through what happens when people are up for removal.
I was actually going to ask you a question regarding that as well, as to what does a typical deportation trip involve? Can that process also contribute further to the health risk? And can proper protocols be even followed when there are thousands of deportation flights taking place?
So what happens is typically a person will get a notice to appear at the CBSA office. So in the Toronto area, it's by the airport. So people often have to take public transport to get there. The process involves several appointments. So you do this several times. If somebody is given a date to leave, what happens? They've been here for years, very often. They have to then kind of pack up their lives, right? So you have to sell your furniture. You have to do banking. You have to say your goodbyes to people. All of that requires interaction. Then you go to the airport and you get on a plane. Of course, throughout all this, there's a risk not just to the person who's being removed, but also to the people around them. And of course, to the CBSA officers as well, who are tasked with a job that is fairly high risk. So the person gets on the plane. Sometimes to get to their country of origin, they need to go through a number of airports, multiple flights. There's a risk, of course, in that. And then when the person arrives in their home country, what happens? They have to reestablish themselves, right? Get their life back together, find a place to live, interact with government offices to get certain documents in place and all of that. Again, a renewed risk to themselves, a renewed risk to the people who are around them. So there's many steps of the process and each one poses a risk, and there's really no need to have such a risk.
We'll be right back. As you mentioned, the United Nations Network on Migration also called for caution on this, and you're talking about all of these risks. So are we potentially exposing already vulnerable people to a potentially life-threatening health risk now on top of the other risks and stresses they might be facing back home in these exceptional circumstances? This is a human rights concern, right?
I think it starts with people in Canada because, of course, we have to be cognizant of who we're dealing with. We know that one of the most at-risk groups of people in terms of COVID-19 risk are people in racialized and migrant communities in Canada. We know that they disproportionately suffer impact of COVID-19. People are working in long-term care homes. People are, migrant workers. So that's established. But some members of this community are the very same people who are up for removal. So there's that additional factor. And, as well, they face the risk of then being deported and removed into their home countries. And there's problems that are exacerbated as well, because if someone has a pre-existing condition, it's even more risky. So in the past few days alone, I've heard of dozens and dozens of people who have been called in by CBSA for removal. And this is just in the Toronto area. So this is happening, don't forget, nationwide. And the people I've heard of don't pose any security risk to Canada. They're not people with any serious criminality behind them. They're just regular people whose status has expired. Sometimes people come as workers and they don't renew their permits. Sometimes people have sought refugee protection and they've come to an end of the process. So that's the type of people we're dealing with. So one example is a family from Portugal, husband and wife, came to Canada on work permits. They've been here now for 8 years. They've been working, they've been paying taxes. They ended up having problematic legal advice, and so their status didn't get renewed. We know, of course, Portugal is a very high-rate COVID country, and the man in this case suffers from diabetes, so he's extremely high risk, and he's set to be deported next week. There's just no reason for this. Another example I can give you is somebody from Dominica, a single mom with a Canadian-born son. She had dealt with domestic violence issues. She now has to deal with custody because the son son can't easily be removed because the father's here. She has to deal with us all of it during COVID. And she as well has a pre-existing health issue. She is also diabetic. So again, at higher risk. And she's also set to be removed shortly. So these situations make absolutely no sense. In addition, I heard of somebody who, after the Prime Minister announced the travel ban in terms of flights to Mexico, someone who was being removed from Vancouver to Mexico had that flight canceled. We were thinking, well, perhaps it would be suspended like it should be to avoid health risk. But no, Vancouver through Toronto, through somewhere in the United States, through Panama to Mexico with 2 children, 2 days of flights, 3 airports. How does that make any sense at all? It just screams health risk, health risk, health risk, and for no justifiable reason.
You're talking about all of these people who are at high risk, who are vulnerable, who are facing the prospect of deportation in the middle of a pandemic. This must be not just legally, but also mentally and emotionally an extremely challenging time for them, right?
It is. I mean, aside from people having health risks, there's people who have psychological conditions that make them more vulnerable as well. So we know that that just exacerbates the situation, but there is no attention paid to that. It can't be that as most branches of the government are taking cautionary measures, CBSA is an outlier and is actually engaging in actions to people who are in already vulnerable situations, putting them more and more at risk. They're at risk. The people who they interact with at risk. CBSA officers are at risk, and it's unfair, it's even cruel and completely unnecessary.
And what about access to the process of justice to appeal their cases? Although we know that the agency has said that deportees are given access to appeals, judicial reviews, and other applications on humanitarian and compassionate grounds, but are these mechanisms currently sufficient during a pandemic?
No, they're completely insufficient when there's no pandemic. I can tell you that much from someone who has dealt with many, many, many people in this situation. So once you're in removal proceedings, it's like a web and it's next to impossible to get out of it. So we know that a person has to interact with the CBSA officer, and there is a process to try and stop the removal. You have to make a submission with evidence to a CBSA officer. So that's a rather complex application. It's almost impossible to succeed on, even when you have legal counsel, let alone when you don't, and let alone when you don't have English skills necessarily. So making this application is something that's not accessible to many people because, let's face it, legal fees are expensive. And especially during a pandemic, people don't necessarily have that extra money. You could also go to the federal court. Again, it's a judicial process. It's very complex. It's not accessible to the average person. Yes, somebody could go to the court without a lawyer, but really, it's not really proper access to justice. It's not a sufficient remedy.
And I can imagine the system would have slowed down because of COVID-19 restrictions as it is. Not enough time to slow down these deportations that are happening.
It's a real problem. And also, I think we have to step back from the individual cases and think, well, why should it be on vulnerable individuals to fight the government and to try and stop something that's really a matter of government policy? Why should it be on those individuals? That's not fair. That's a burden that's far too heavy. That's something that the government has to take on and change.
Maureen, I wanted to ask you whether these mass deportations also affect the relatively new Guardian Angels program, which was aimed to grant resident status to those who were working on the healthcare front lines. So that's still being ironed out, and nothing's quite clear on that front as well. So do you think this could kind of overlap as a problem?
So Minister Mendicino announced a special program for people in the refugee stream back in August. That was a very much welcome program because it really recognized the contributions of people in the pandemic context, right? People working in hospitals, people working in long-term care homes, and granted them a pathway to permanent residence. The program was rolled out in December, so applications are being taken and are succeeding at this point. It takes a certain amount of time for somebody to gather up their documents and fill out the forms and submit them. I understand that people aren't meant to be removed if they reach a first stage of approval. I'm hoping that even if they have submitted their application, that CBSA would decide not to remove them. I'm also very much hoping that because this is such an important type of program, and of course it's recognized that Canada needs more immigrants to succeed economically because of the economic damage much because of the pandemic, that Minister Mendocino will expand this program and allow more types of workers to apply and people with different types of status to apply, because I think these types of programs are really a win-win situation, right? They're a win for Canada because our economy will be on the right track, and they're a win for the individuals who've been working hard and contributing to Canadian society.
Right, and bringing so much value. At the same time, these other developments that we've been talking about, these mass deportations and putting so many people at risk who are already vulnerable as it is, how does this sit with Canada's perceived image as a world leader in welcoming those fleeing persecution and seeking refuge?
Canada has always been a beacon for those who suffered human rights abuses, for those who want freedom, for those who value human rights. And Canada can continue to be so with programs such as the Pathway to Permanent Residence. But CBSA has to rethink this policy and put the brakes on immediately. I think that's crucial.
Thank you so much for being on the podcast, Maureen.
Thank you, Saba.
I was speaking to Maureen Silcoff, the president of the Canadian Association of Refugee Lawyers. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.